seeing hospitals transferring patients around the state, trying to find empty beds, the real strain in terms of ICU beds in particular. I imagine that has to be dominating in terms of local news and local discussions, but for some reason that doesn't seem to have translated into the kinds of changes in behavior that might slow the spread.
It hasn't. And I think the level of severity is maybe not being shared to the right people in the right way. I know that some of our bed capacity, the local hospitals are used to being occupied and being highly full for census. And so some of this is normal operation. They've had some essential types of things that have been put on hold and or elective types of surgeries from earlier in the year and are now being taken into consideration for surgery. And then we have COVID cases on top of that. And then what's very concerning for local public health is the possibility of the influenza season, which is upon us, and what that could possibly mean if we start to see influenza cases increasing in our state with an already stressed system. So that's why local public health is taking some extra steps to look at that.
As the number of ICU beds available in the state declines to sort of seriously small numbers, seeing less than 30 beds available across the state, while those new infection numbers rise so steeply, and so you know that that's going to result within a couple of weeks in additional people turning up sick and needing hospitalization. With Bismarck, where you are having only one ICU bed available right now, only 3 staffed hospital beds beyond that available, I have to ask if there's some sort of plan B, if there's any plan to build field hospitals or to come up with some other sort of plan for how people can be taken care of, especially in an intensive care setting. It feels like you, as a state, are being really pushed to your limit.
So I know here in Bismarck, when we are that short on beds, they often look to other facilities within the state. So likely Fargo, which is about a 3-hour drive from Bismarck. And so if you're thinking about someone that maybe suffers a heart attack or a stroke and needs that emergency care and would end up in an ICU if there's not a bed, they could be transported to Fargo or out of state possibly if there was no room at Fargo hospitals. And so that is something that we're keeping track of here. I know the State Health Department is keeping track of the ICU beds. We are prepared. Hospitals have their surge plans and their tiers in place. And I know one of the local hospitals has added additional 14 COVID beds within the last couple of weeks. And I think those are already occupied. And so as we continue to add beds and they're filling, we look to that next stage. And when you're looking at that next stage to tier 3, are you looking for additional bricks and mortar? There are possible site locations where we could set up hospital facilities and field hospitals if needed, if that were the dire situation that we were in. We hope not to get to that point. But the biggest concern, I think, for us, too, is to consider not just the bricks and mortar of it, but the staffing and who's going to take care of those patients. Mm-hmm. We are already short on staff for nursing, and that was a problem before the pandemic was here. And it's just been exacerbated by the number of COVID patients that we're seeing. And then if we have flu patients on top of that, the biggest concern rather would be staffing and not necessarily the ability to set up additional bed locations.
Right, because the beds are only useful to the extent that they're staffed by the expert carers that need to be there, especially in intensive capacity.